Hi, my name is Sofia Correa, and I'm going to talk to you about healthcare quality improvement. We are going to start by defining what healthcare is. Healthcare is the maintenance and improvement of physical and mental health, especially through the provision of medical services. Right now, I'm going to show you a very interactive video that tells you how to choose the best healthcare for you.
But we all know one doctor isn't the same as another. How do you find a doctor who gives you the quality of care that's right for you? You could select your doctor by convenience, but being next door doesn't mean a doctor provides high quality. You could ask your friends or neighbors, but they may not know the care that's right for you. How about choosing based on the doctor's reputation? That should be a good guide, but how can you be sure that the reputation is based on information you can trust? From people who need the same kind of care you do. If none of these strategies work, then what? You need information about local providers that is independent. That information should come from a trusted source that allows you to compare results across your community. Information that helps you to be a better patient so you can be in control and receive better care. Here's the good news. This information does exist. Independent, unbiased, accurate ratings of healthcare providers that can help you make key decisions about the quality of your healthcare. Nonprofit organizations across the country have developed resources to report comparable, useful, and trusted information about the healthcare quality provided in clinics, medical groups, and hospitals. Here in Minnesota, you can...
So there you have how to find the best healthcare for you. The second definition that we have is quality. Quality is defined as a measure of excellence or a state of being free from defects, deficiencies, and significant variation. Here, this doctor is defining quality related to the healthcare, which is a six-step relation.
Dimensions of quality. If you're buying a car, there are dimensions of quality: safety, fuel efficiency, comfort, fun in driving, durability, and so on. We're used to that. What are the dimensions of goodness in healthcare? And the Institute of Medicine, Crossing the Quality Chasm report, gave us 6 dimensions and said these should be the areas for healthcare to improve on. It also summarized a lot of the research literature on the current levels of performance for those 6 areas. And here are the 6 areas. The first one is safety, back to the report from a year and a half earlier, to err is human. Safety means we're not harming people with our care. We're not adding to the burden of illness. So a safe healthcare system reduces hazards and risks from the care itself, safety. The second dimension they called effectiveness. And that was a term that sort of was meant to mean matching science to care. So if science says that this drug can help in this disease, then we use that drug. And if science says this can't help, we don't use it. So avoiding overuse of things that don't help and assuring use of things that do help, avoiding underuse, that's effectiveness, lining up science with care. There are big problems with effectiveness. The RAND Corporation famously published a study a few years ago which showed that of the needed effective care that Americans should get, when they tracked 7,000 people over 2 years, those people who had all sorts of things ranging from just well care to serious chronic illness, those 7,000 people failed to get 45% of the care that would help them. So that's effectiveness. The third dimension is patient-centeredness. This is a pretty subversive goal. It means people should be in control of their own care. They should make decisions about what affects them. We say, nothing about me without me. It's putting the patient in the center of the care system, giving them power and control over their own lives and their own care. The fourth dimension is timeliness, which means avoiding delays. People are quite familiar with waiting rooms. We wait a long time to get in to see the doctor in the emergency room. We're waiting for an appointment. In all other industries, timeliness is an important dimension of quality. You don't want to wait everywhere, nor do you in healthcare. So timeliness is reduction of needless delay. Some delay is instrumental. You want to wait to see what happens, but there's a lot of non-instrumental, very costly delay. The fifth dimension is efficiency, which means avoiding waste. throw out so much in healthcare. We give things that can't help. We duplicate procedures and tests. We lose records. We lose the ideas of the workforce by not inviting them to join in invention. So efficiency is a big word. It means stop wasting stuff. We're very, very wasteful in healthcare. The last dimension, which some people think should be the first, is equity. And that means closing the gap.
So there we have all the 6 dimensions that are related to quality and healthcare. Now we have applications in medicine. We have different quality problems that serve as evidence that we are actually misusing the healthcare. The first thing that we have are variation in services. There continues to be a pattern of wide variations in healthcare practice, including regional variations and small variations. This is a clear indicator that healthcare practice has not kept pace with the evolving science of healthcare to ensure evidence-based practice in the US. The second proof that we have is the underuse of services. Millions of people do not receive necessary care and suffer needless complications that add to costs and reduce their productivity. Each year, an estimated 18,000 people die because they do not receive effective interventions. For example, a study in Medicare patients who had suffered from heart attacks found that only 21% of eligible patients received beta blockers. The mortality rate among patients who received beta blockers was 43% lower than it was among the non-recipients. The third proof that we have is the overuse of services. Each million Americans receive healthcare services that are unnecessary, they increase costs, and they may even endanger their health. Research has shown that this occurs to all populations. For example, an analysis of hysterectomy performed on women in 7 health plans found that only 1 in 6 operations was inappropriate. A study examining the use of antibiotics for treating ear infections in children on Medicaid found that expensive antibiotics were used far more often than indicated. So that's the overuse of services. And the fourth proof, to summarize that all of them, is the disparities in quality. This is talking about that although quality problems affect all populations, they may be most marked for members of ethnic and racial minority populations. Researchers at the University of Alabama examined the use of thrombolysis for patients who had experienced a heart attack and found that while this evidence-based life-saving treatment was underused for all, Black Medicare beneficiaries were significantly less likely than whites to receive this treatment. So there we have a minority problem. Now, how do we improve the healthcare? First is by bringing evidence-based medicine to hospitals. Researchers at the University of Iowa are carrying out a 3-year randomized study at 12 hospitals in Iowa and Illinois to evaluate the effectiveness and cost-effectiveness of implementing an evidence-based acute pain management guideline for hospitalized elderly hip fracture patients. The second one is understanding the variability in community mammography. This community-based multi-center observational study involves a unique collaboration among 3 geographical distinct breast cancer surveillance programs in the state of Washington and Colorado. The investigators are collecting breast cancer outcomes and interpreting the data from more than 500,000 mammograms from 91 facilities and 279 radiologists. The goal is to identify the reasons for variability in the interpretation of mammograms and determine how the quality of mammogram can be improved. And the third one are racial and ethnic variations in medical interactions. In a 5-year program, researchers at the Baylor College of Medicine in Houston are developing tested interventions to improve doctor-patient communication patterns to reduce racial and ethnic disparities in use of outcomes. Both the clinician and the patient are participating in the project, which also includes an information dissemination component to translate research findings into practice as rapidly as possible. Now here's a video on how a different country from the US is trying to improve their healthcare, and they're doing it by 3 steps that are going to be shown right now.
busy every day, trying to make people well. Trying to save lives. There's more we need to think about. What new evidence should we take account of? Are we spending public money wisely? How do we keep patients safe, as well as improve the level of care that we provide? It's not easy, and we want to improve what we do, not stand still. And that's where we need help. Help to ensure we improve. To let us know what evidence to take account of, and to check that we're doing the right thing by our patients.
Healthcare Improvement Scotland is the national body set up to support our healthcare professionals find and use the best advances in medicines, technology and medical practice. We believe that every person in Scotland should receive the best care possible every time they come into contact with our health service. And, as a national body, we help to ensure that every hospital, every GP practice, every clinic improves the care they provide to you and your loved ones. Here's how we work.
Healthcare Improvement Scotland helps us make sense of new evidence and know what evidence is worth putting into practice for the benefit of patients.
They help us to put that evidence to work, helping us to change the way we do things, and working with us to get the best results possible.
As patients, how do we know we're getting the best care? Healthcare Improvement Scotland looks at how well care is being delivered and publishes its findings so that we can all see for ourselves.
So those are the 3 methods that Scotland uses to improve their healthcare. What are the pros and cons? Evidence, they have evidence for everything. As you already saw, they're trying to bring in, they're trying to promote evidence-based medicine. Also, this improves patients' clinical experience, obviously, and it also improves doctors' ability. The bad thing about this is that trying to improve healthcare has a high cost, especially in the US. So here's a video about the financial state in the healthcare in the US.
Is MDI TV.
We've got a problem with success. The successful development of medical tests and treatments continues to drive healthcare spending higher.
So right now it's buffering, so you have to wait. Let's just play it again. Maybe it's gonna work right now. This is actually the 3rd time I'm recording this, so I'm not gonna repeat it. Anyway, now the related topic about healthcare is Medicare. Medicare is the goals for Medicare are free or subsidized treatment by healthcare professionals such as doctor, specialists, optometrists, and in specific circumstances, dentists. Free treatment and accommodation as a public Medicare patient in a public hospital also. But what are the different things that Medicare offers you? Here's a video that tells you a little bit more about the things that they offer you.
Really confusing. Like, when do you have to start thinking about all this stuff? Well, if you're coming up on the magic 6'5", it's time. Or, if you're like a lot of us and retiring later, you're ready as soon as you don't have employer health insurance anymore. Maybe you already have a Medicare plan, but you're thinking about switching it up a little bit. No matter what's going on, you need to know some basics. So let's get started. Medicare has 4 parts: A, B, C, and yep, you guessed it, D. Plus there's this 5th thing called supplemental. We'll get back to that. So what do the letters really mean? Well, Part A is for when you go to the hospital. And you get it just by signing up for Medicare. We have a whole nother video that explains signing up. For most, you get Part A automatically, and it costs you zero, nothing. Parts B, C, and D, on the other hand, are optional. If you want them, you buy them. Part B is for when you go to the doctor. Stuff like routine physicals, blood pressure checks, tests, things like that. Part C, well, let's say you want to add eye care or dental coverage or something else. That's where Part C comes in. It's also called Medicare Advantage, and it's pretty cool. Part C combines A and B along with some of the other stuff you want. Then there's Part D. Part D is prescription drug coverage. Now, you can buy it on its own, or you can get it with Part C and wrap the whole thing up in one neat little package. You can also buy a supplemental policy if you want. They're called that because they cover some of the costs not included in A or B. Well, there you go. Those are the basics.
So yeah, maybe let's see if the other video that I was going to show you works. Yeah, I don't think it's going to work. Anyway, thank you.